Hello friends, welcome to my YouTube channel. I am a DNB resident general medicine in GMERS, that is Gujarat Medical Education and Research Society Vadodara. Of late, I have been getting multiple phone calls from different NEET PG aspirants asking me whether to take DNB medicine seat or not, and what are the pros and cons of DNB medicine, and are we going to land up in some trouble because of the increased fail percentage of DNB, and is it very tough to do the duty, and what is the working hours in DNB, and what is the work life balance, are we getting time to read or not, and basically I have come up with an idea of making a video to sum it up everything for you. So I have completed 6 months of first year of DNB residency in internal medicine, and I feel very satisfied and content with the work that I have done over these 6 months. I can tell you about my hospital, which is in Vadodara. It's basically a 940 bedded hospital, and the inpatient capacity is 940, and in general medicine the total seats are beds are 180 in general wards, 90 in male wards, and 90 in female wards. And I have 9 bedded medicine ICU, 11 bedded intensive care ICCU, so 20 ICCU beds, and 180 general beds in general wards. So it's a packed hospital, and it's a semi-government one. So in my hospital, I basically look after one ward in the male ward. This is comprising of 30 to 35 patients, and from admission to discharge, I have to take full care of that patient. So that is my work, what I'm doing. And we are also having two OPDs in 1 week, so that whatever admissions are there in that over 24 hours, those admissions that those patients you have to take care of. So, and also having two casualty duty per week, which is one is will be some 6 hours, so one will be comprising of 12 hours of a night duty, one night duty per week. So that's my job, what I am doing over here. So basically I will tell you that what are all the similarities of DNB medicine over MD medicine. So the procedures, regarding the medical procedures, getting in hand medical procedures. So I am very fortunate enough to work in a hospital where I have learned all the procedures in the within a span of 6 months in the first year, whereas in other hospitals they, I think, only in second year you can be able to learn the procedures. So ascitic tapping I have learned, pleural tapping, endotracheal intubation, ventilator setting, central line insertion, lumbar puncture, and my seniors are also doing bone marrow, uh, uh, everything. There is no limit to, we do all procedures. So in my hospital I get a free hand for doing all the procedure, unlike in the private DNBs where you just have to do the paperwork, focus more on the paperwork, and in hand experience is very less. So regarding the academics, I also have academic stuff every week, the case presentation with all the available faculties from general medicine, and there is also interaction with super specialist, like neurologist, like nephrologist. We do renal biopsy with the nephrologist, UST guided, and we present case to any neurology case we present to neurologist, and nephro case we also present to nephrologist. That also helps you learn a lot about that particular DM subject. So we also have excellent faculties who guide us all the time whenever we are wrong, and helps in learning about what negative history that you have missed, and what exam findings you have missed, and whatever you have misdiagnosed, that really helps in improving your clinical skills and practice. And basically for getting time for study, is what I get get calls to regarding whatever getting time to study. So I can assure you that around 3 to 4 hours of study you will get. I don't think I have studied to whatever I'm getting that much of time, but you can get 3 to 4 hours of study per day. Every day you can get. So time to study is also one major advantage that will help you for your preparation for DM examination also. One disadvantage that I will tell you, I don't consider it as a disadvantage. The disadvantage is like exams are very difficult to crack, as the exam in DNB is usually conducted by NB, and it's in a different state, in a different language, and it's very strict environment. uh, Unlike the MD students who get benefit, as they can means interact with their consultants. They really help them. Their consultants are the internals. They do have internals, but we don't have internals. We all we have is externals. So nobody is there to support us in our exam. But recently the pass percentage have improved too much, and if you do extra hard work for passing the exam, that is for your benefit only. Regarding the thesis topic also, the it's very you have to be very genuine, you have to be very honest, and you can't copy paste everything from your seniors, just like my friends from MD medicine are doing. So we have to physically approach each and every patient, enter the data, enter the details, and cannot falsify data, and to you have to be very honest with your honest and professional with your work. So basically, I summed up whatever I knew regarding my experience over these 6 months, and I hope this really helps. If you want to really take DNB medicine, take in a government setup, and government setup, you also have these junior means UGs whom you can teach. I'm also very fond of teaching. Stuff, so that also helps you improving and increasing your clinical practice and aptitude. So we are also work is like you have to take exams, you have to conduct we have to means be very proactive in exams of these undergraduates, and you will learn a lot of stuff. So basically I would advise you to take government DNB seats, because you will get a lot of cases, you will get a lot of exposure, and that's it for today, guys. uh, I hope I have dealt with all the queries that I have been receiving from past 1 month. Um and all the best. The counseling is ongoing, and any queries are there, means you give comments, you mention those in the comment box, I will reply them. Okay, fine. Thank you.